Good afternoon, everybody, and thanks for joining us on Facebook Live. I know this is my first time on Facebook Live. Probably the same with my colleagues here, but thanks for joining us. Today, I'm here with three of my colleagues: Dave Mangalot from the vascular and vein surgeon from Longstreet, Barry Munn is an orthopedic surgeon from the Longstreet Clinic, and Matt Hazard is a neurosurgeon from the Longstreet Clinic. My name's Chad Copper. I'm a general and robotic surgeon at the Longstreet Clinic. Today, we're here to talk a little bit about how coronavirus has affected our practices, how it's affected surgeries, both in our practice and at the hospital and surgery centers, and how we're kind of getting back to safely resuming those schedules, and why it's important for patients not to delay care and get their care in a timely manner. For those of you not familiar with the Longstreet Clinic, we're a primary and multi-specialty care clinic. We have 11 locations, more than 200 providers in 18 different medical and surgical subspecialties. And these guys represent some of those surgical subspecialties. So with that, I kind of going to just ask these guys some questions and kind of cover some different topics, but we'll start with you, Dr. Munn. Are you guys back to being fully operational from a surgery standpoint from where you were pre-COVID?
Yeah, we have certainly picked back up. There was a time in March and April when both clinic and surgery really slowed up. We're playing catch up now, and have had full clinics and now full OR days now for going on a month. We've done everything as safe as possible. We see patients in the clinic and screen them all. Hospital is doing the same. So I think comfortably we're back to creeping back into more normal.
Good. So, Dr. Mangalot, have you guys seen the same thing? How are you guys dealing with that backlog of patients? These patients that had stuff either scheduled in March and April, or new patients you were seeing along the way, and how are you guys working through that?
Yeah, since about mid-March when all this started, we started kind of quickly keeping logs of patients that, trying to triage them as far as people that needed to be done more urgently, who could wait a while, and just been keeping track and reassessing them as a practice every week. Those that were more critical in nature, we would be touching base with them. And some people had to have procedures during that time just because they couldn't wait. We are getting caught up and just, the hospital a few weeks ago started allowing both hospital systems as far as doing procedures, if they could get in and out of the hospital fairly quickly, either as an outpatient procedure or go home the next day. And now the hospital systems are open up to where we're starting to do more elective stuff that require a couple of days in the hospital. But yeah, I think as far as if you have a, previously canceled surgery and any of the practices haven't touched base with you just because of all the confusion, definitely reach out to us to make sure that things are on planned as scheduled.
Absolutely. I will make a note here. There was one hospital in particular in Atlanta that was showing some ads saying that, they're still taking care of patients, and the surgeons and doctors at Longstreet Clinic, as well as at Northeast Georgia Medical Center, never stopped taking care of patients. And whether that was a cancer surgery or a vascular surgery or an orthopedic surgery or neurosurgery, we never stopped taking care of patients. We did delay some elective procedures in the effort to keep people safe in the area of the coronavirus. But no one ever stopped taking care of patients and doing what was absolutely best for those patients at all times. So just wanted to kind of note that to some other people out there. So Dr. Hazard, we've noticed some changes around our clinic, and coronavirus kind of brought some of those changes that were in the works up to the forefront. One of those was telehealth. Can you kind of talk about how some of that's impacted your practice?
Absolutely. Large, quick learning experience for us. Prior to this pandemic, I had no experience with telemedicine or televideo. Um, but honestly, it's been a blessing in disguise because we're able to reach patients who travel from far distances. We have patients way up from the mountains, 3 hours away or so, that are able to connect with us in a more readily available fashion. And we're able to actually do a formal consultation online with them. As long as I have access to their imaging, I can help go through their symptoms online, and we can review things together and determine what the best course of treatment might be, even if it's just temporary or initial treatment, to get them out of pain or in towards relief sooner rather than later. And sometimes people don't require surgery to manage some of their painful neck or back symptoms. And in that situation, it's even better because I can plug them into local resources which are closer to their home rather than bringing them down here an extended drive down here and then go back. And for providers, and the other piece of it I'd say is I've had patients that literally have been on their normal daily activities, doing a delivery route or whatever, and will pull over to the side of the road and do a 15-minute phone consult or televideo consult with me. And I think of how convenient that would be as a patient to not have to come and basically, wipe out your day to come for a doctor's appointment and then come sit in the waiting room with a bunch of other people that may be sick or maybe not. And I think that it adds a real level of convenience to patients. I know that I certainly would appreciate that in certain situations as well. And clearly, we still will bring patients in that need to come into clinic. We are doing that in obviously a restricted manner in terms of making sure that we're bringing people in that are appropriate to be brought in, and also making sure that they're screened at the door for any sort of coronavirus symptoms or fever, those sorts of things. And we're also limiting who can come back with them at this point. As you know, it's a game of numbers. So the more contacts you have, the more likely you are to get exposed. So we're doing our best to try to bring people in safely and still address their.
I know we changed over to Epic last year, and now with MyChart, that's given us a lot of functionality from that telehealth arena. People are able to use their MyChart account to contact their physicians and do video chats, just like you were talking about. How do you think this is going to influence things going forward? Do you think this is just going to be a coronavirus time thing, or do you think this will impact your practice in the years to come?
Honestly, I think that this has served as kind of pushing us towards a broader catchment for patients, honestly. So you think about how long we've had FaceTime and different technologies like that, and yet we haven't used them to the best of their potential. I really think that this expands our market or our footprint, or can. I think we're able to reach more patients, and I think even provide second or third opinions sometimes where otherwise patients may not have wanted to travel for those opinions. So I think that it will certainly play a role in the future. I think it creates efficiency on both sides, both for the provider and for the patient. And I can see it being a part of our practice in the future as well.
Gotcha. So let's go back to Dr. Munn. In your practice, you guys are both in the office. You've got both your orthopedic practice, and then in that same building is physical therapy. Is physical therapy seeing patients now? And what's your office looking like these days?
Yeah, so therapy is up and running. They've modified some of their day-to-day operations, have spread patients out. All of the patients are screened. Again, they limit access, like Dr. Hazard was saying. All of the equipment is cleaned and sterilized between patients, and then the whole building gets a deep clean on the weekends. So I don't know if they're at full capacity or full pre-COVID capacity, but they are seeing lots of patients and doing lots of good. As far as our clinic, very similar. We share the same building as the therapists, and so they all check in at one place, and we again are running everything by CDC guidelines and trying to keep everyone safe, including the physicians and the patients. So.
I know one of the things that Longstreet has done is, you guys both talked about it, was limit the number of people in the building. So we're limiting patients to one visitor with them in the exam rooms and things, just to limit the total number of people that are interacting. I know in some of my clinics, we've got, like this week, talked to a brand new breast cancer patient, and that's a tough diagnosis, and that's something that the whole family wants to be there. We did make use of, like Dr. Hazard talked about, we made use of FaceTime. We put a couple other family members on FaceTime and had them right there in the room with us. But we really appreciate the patients being understanding of that, and understanding that they're not just looking out for themselves, but looking out for other patients. Everybody's wearing masks. I haven't seen a whole lot of pushback on that. People have been really good about that. So really appreciate our Longstreet patients just really chipping in there with us, and everybody looking out for everybody else. So.
Yeah, I think you see these signs that we're all in this together, and it really has played out that way in here in Gainesville and in the clinic in particular.
Absolutely. So when we're talking about screening, I know Dr. Munn just talked about some screening stuff that we do at Longstreet. Dr. Mangalat, can you kind of talk about screening for both your vascular access center as well as for the hospital and surgery center, and some of the things that are being done there?
Yeah, so I think pretty much across the board, whether it's coming into the office or having procedures at any of the facilities, there's questionnaires. Are you having temperature? Have you been exposed to other people that have been sick? Travel history, any of the symptoms. That's definitely a first step. I think all the hospital systems, and you'd probably be able to comment on the surgery center, but I believe within 7 days of a procedure, having testing for COVID-19, and if that's positive, then we touch base with the patients and recommend that they be quarantined. Some of the longs we offer, Dr. Davis and Danny Webb done a great job with the COVID clinic, and there have been some patients that have really been able to probably prevent hospitalizations by being able to offer telehealth and home health and coordinate oxygen and stuff. But I think everybody's been really good about checking for patients and doing aggressive screening and taking the CDC guidelines.
Yeah, I know I've seen over at the hospital, and you guys can both comment. All four of us operate at Northeast Georgia Medical Center. I know Dr. Hazard does quite a few surgeries down in Brazelton, so he can comment on that. But just I'll talk specifically about the surgery center. You're screened when you walk in the door with temperature checks. Patients are screened 3 to 5 days before any procedure for coronavirus. So, I've told my patients, I honestly feel like you are more at risk going to Kroger to get a gallon of milk than you are coming in to get your procedure done over at the surgery center or any of our facilities. We already, being a medical facility, are, very concerned about cleanliness and things, but since coronavirus, it's lockdown. So I really feel that patients are very safe at the surgery center. You guys want to, Dr. Hazard, you want to comment on Brazelton and kind of some things going on down there?
Sure. Yeah, I think they're likely doing the same thing system-wide as they would be at Northeast Georgia, Gainesville. Essentially, that you do have a screening process where prior to proceeding with any surgery, whether that be elective or urgent, emergent, you are screened for coronavirus. And that will apply in the emergency situation. So if you come in through the emergency department with a bad back fracture or neck fracture that we have to fix, they typically will send an in-house screen as well as a secondary screen to a different facility. The send out takes a little bit more time to come back, but at least you'll have the in-house back between 1 to 4 hours or so. And so for elective cases, it's very similar, but to your point, Dr. Copper, it takes about 5 to 7 days ahead of time that you'll need to know, at the very least 3 days ahead of time, whether or not someone has coronavirus or not. And if they do, and it is an elective case, it is postponed until such time that it makes sense to proceed.
Gotcha. Dr. Munn, do you want to? I know the medical center is much the same. We've had, when people pull up to the medical center, it's a little scary right now with buildings and other stuff going on out front. But you want to kind of tell everybody what's going on there and what's been done at the medical center?
So I think early on, we did what everyone did. We shut everything down and just saw emergencies, and elective surgeries were completely delayed. Since then, we have moved to slowly opening back up in stages. We're kind of basically back to a normal schedule at this point, but still taking the sicker folks, the ones who are more at risk, the ones who are more likely to require in-hospital stays. Those we're certainly proceeding with more caution. I think a lot of us have shifted to do as much outpatient stuff as we can, doing them at the surgery center, which I don't think has had a positive case done there at this point.
No, I agree. I don't think there's been a positive. There has not been a positive COVID case done at the surgery center.
Right. So, again, I think there's been a shift towards this outpatient surgery or getting the patients out as fast as possible. Or if somebody's going to require an inpatient rehab, then talking to them in an honest manner and saying, why don't we wait this out a little bit longer and see how we can get you to a time when it's safer to have your surgery. But I know the hospital has designated COVID areas, designated COVID ORs, designated COVID floors, and they have certainly seen as much of it as any hospital in the country, or not in the country, but in the state. So I think we're in pretty good hands, and the leadership there has worked really hard at keeping us being able to take care of patients and not getting overwhelmed.
Yeah, I think most of us have seen, and all the numbers are public. They publish them every day, but the numbers of COVID patients at the hospital have gone down every day for about at least the last 3 weeks. The last number I saw was somewhere in the low 30s, so like 30 patients in the entire hospital. So that's down from well over 130, 140, something like that back in April. So those numbers have just continued to decrease. And I know that for surgery patients, specifically patients operated on by any of the four of us, if you would have to stay in the hospital, you go to usually 2 floors in that North Patient Tower that are both designated as non-COVID floors. So there are no COVID patients on the entire floor. One kind of bad thing about this is that when people are in the hospital, they're not allowing any visitors there. So that's bad because you don't get to have your family with you, but it's good because you're not getting exposed to any more people than you absolutely have to. So, that the only people there are healthcare workers and patients, and that's it. So that's kept everyone as safe as we can possibly keep them, I think. So, Dr. Mangalot, can you kind of talk about patients delaying care? I know we've seen some of that in our practice, and have you seen that in your practice? And can you kind of talk to people about that?
Yeah, there has been, I think with the at-home recommendations, there's been people that have just been really afraid to go seek medical care, whether it be go to see their primary care physician or go to see their surgeon. We've seen that, vascular surgeons are like glorified plumbers. We deal with all the blood vessels of the body except for the heart and the brain. And so patients, and this has been kind of seen nationally as well, there's been a decrease all of a sudden since mid-March of patients coming in with transient ischemic attacks or strokes or heart attacks, and that disease process just doesn't change. And people are kind of scratching their heads saying, where are these people? And everybody's kind of suspicious that people are suffering at home because they're so afraid of going to the hospital. We had a patient a few weeks ago that ended up needing to have a surgical procedure to remove the plaque in their carotid because they had had a stroke, and she didn't want to come in the hospital. She had been having symptoms for 3 weeks. Same thing with people potentially losing their legs because they had a really bad diabetic foot infection that just got worse and worse. Same thing with blood clots. We've had people that been at home and they just haven't been walking around, and then they developed a blood clot in their leg, which then went to their lung. Yeah, we've definitely been seeing, I think people are starting to feel a lot more comfortable now. I think we have a better comfort level even as providers, and the precautions that we all are taking to make sure it's safe for our patients. And I think we're all experiencing that people are coming into the office now. But I would say that, just like Chad, you mentioned before, is this is probably a very safe time for a patient if you had a problem to go to the hospital. I mean, the emergency room is not at full capacity like it typically is.
They've actually laid off some workers in the ER because the volumes are so low right now.
Right.
So yeah, I would second that. I'd say anybody who's having symptoms right now, especially when we're talking about, strokes, chest pain, infections, you're having those kind of things, you absolutely need to come in and get checked out. Those are not things to put on that back burner. In my practice, we deal with a lot of screening exams, whether that's screening mammograms or screening colonoscopies, and we're encouraging patients to get back to doing those. We feel like it's safe at this point to get back to even doing screening colonoscopies. So if we're at the point where we're talking about doing screening mammograms in the Longstreet Imaging Center or screening colonoscopies, then absolutely, if you're having, any kind of symptoms, whether it's, pain or, any kind of infection or, God forbid, some kind of stroke or heart attack, then we definitely need to see you. It's safe now, and we feel like we're providing a very safe environment to see those kind of things. So, Dr. Hazard, I mean, this has been one of the kind of frustrations you can hear it in Dr. Mangolat's voice of seeing these patients that, gosh, I wish I would have seen them sooner. What kind of frustrations has coronavirus kind of brought to your practice?
Yeah, that's absolutely correct. We've seen patients that have had problems with nerve compression, which would lead to a nerve dysfunction. So, for instance, a foot drop from compression on a nerve in your back, that have let it go probably longer than they should have because of the pandemic and because of fear of going to the emergency department to get it checked out, or to their primary doctor who may have been closed. And a lot of those are high risk patients, or at least higher risk patients for the pandemic. So over 70 with maybe lung disease. So I know for sure that we have had some of those patients that do have nerve problems that, unfortunately, the longer that you have pressure on the nerve, sometimes the less likely it is to really functionally recover. So that has been a frustration, especially for us who try to help with those situations, just like Dr. Mangolat with the vascular surgery. And I'm sure Dr. Munn had.
So, Dr. Munn, have you kind of seen some of that same stuff in the orthopedic world?
Yes and no. Like some of our things there are things that we need to fix acutely, like a fracture or a fresh traumatic rotator cuff or bicep tendon rupture, quadricep rupture. All those things we never stop doing. It's certainly easier to fix them acutely than it is to go back and fix the problem that's been created. but um, you know, we're about getting people back to function, and so if people are not able to walk and get around, and that's why we've started doing more of our elective load as far as arthritis surgery, etc.
Yeah. So, um, yeah, I know, some of the things that we were shut down there, like you said, for a while. So, all of us kind of try to do other things to keep us busy. Or there some of the stuff we've done at the surgery department. We, collaborated with the medical center in NGPG to start a hernia center of excellence over at the hospital. That's going to actually be opening next week. And I think that's something positive that's going to come out of this time that we kind of had to spend on other things. Are the things that you guys have been able to turn your attention toward, and some stuff that was kind of on your back burner that you've been able to make lemonade out of lemons here? Nobody?
I think it gave us,
Yeah.
we had plenty of time and to kind of just fix some processes in the office, whether it be just surveillance protocols, how we deal with limb salvage and blood clots and stuff. For us, the slower time, as much as kind of we're fiddling your thumbs, it gave us time that we're usually busy and we never have time to kind of sit down and reassess the workflow in the office and to make
It's those little things that make such a difference for your experience and patients' experience when they come to your office. You don't pay attention to it when you're just going so fast, but those kind of little things just make everything work so much better when you got the time to actually sit back and look at them.
Went through all my preference cards at the hospital, the OR. They had time to change my trays. So.
Exactly. So, well, good. So what's kind of the take-home message that you've come up with, Dr. Munn, as far as lessons learned from COVID-19?
Buy a lot of toilet paper and hand sanitizer for sure.
That's good.
But I think we'll be much more prepared for something like this when it comes back. I think everybody, including the hospital, public health officials, patients, everybody's learned that it's not business as usual, and you have to make adjustments. I think it's incredible the amount of changes that we have made in 2-3 months. It's incredible that we've been able to function as well as we have been. So that's the big thing. Is I think we've got processes in place now, and we know what we can do. Like Dr. Hazard said, we've all done telehealth, and none of us had done telehealth before this. And,
right.
I guess that's the biggest thing I've learned is just keep going.
Gotcha. And as we get further into this, we all see the number of papers and the amount of research that's being pushed toward COVID-19. We're learning more and more every day, every week. All of our, journals are just packed with people writing papers on COVID-19. One of the things that I saw was, that certain people have had some vascular related complications, some coagulation disorders associated with COVID. Dr. Manglot, can you talk a little bit about that and what those effects are?
Yeah, I think it's still kind of early. I mean, if you think about this, it's kind of been since mid-February, and we're just people are rapidly gathering data. I think there's been everybody's known and seen that there's been an increase in a thrombotic event, so forming clots both in the venous and the arterial system. And there's definitely a lot of people that have had increased or incidence of stroke and pulmonary embolisms. And I think the kind of the thought process is that it's just the body's immune system fighting the virus, but it's just in such a rampant way that it just exacerbates the clotting cascade. And they come in with these huge D-dimer levels, which is just a manifestation of inflammation. And right now different hospital systems have protocols when somebody's tested positive that they're on a blood thinner, protocol. But yeah, I think it's really just a manifestation of our bodies. If you have COVID, you're at a higher risk of it because it's just fighting the disease process.
Gotcha. Dr. Hazard, give us kind of some positive last comments there. What are some positive things that you've seen, some inspiring stories you've had over these past couple of months?
Yeah, sure. No problem. I would echo or reiterate the fact that we've been able to reach, I think, a broader footprint of patients in maybe a more effective way. And I think that's a huge positive. I think the patients that we have unfortunately had to operate on are certainly very appreciative of that. And I've seen that there's been a lot of support for us in the medical or healthcare professions. I think that's been positive. And I think that there are a lot of other positives that will come out of this as well. I think that we've seen that the government somewhat has pushed forward some relaxed restrictions on televideo visits and allowing us to actually perform patient relationship over a televideo visit, where in the past that wasn't really a thing, or if there's something we could explore. So I think that that's going to be a positive, and I'm hoping for more positive changes as a result of this, so that if this ever happens again, hopefully it doesn't, obviously, but if we ever have anything like this again, that we have more options ready at our disposal.
Good. Well, before we sign off, anybody have any final thoughts, any other things that we want to share? I will say, just remember, this is an uncertain and very scary time for everyone. We're all learning as we go. I want to thank all the patients at the Longstreet Clinic who have worked with us as partners over these past couple months. We really are blessed with the kind of patients that we see each and every day. Remember that care is available, and we're ready to take care of you in a safe manner. We really feel like we've got policies and procedures in place to keep all of our patients safe at all of our locations. So feel free to share this information with your friends and family. Facebook Live lives forever, I guess, so you can watch us as many times as you want. And in the meantime, wash your hands, wear a mask, and keep your social distance, and everybody stay safe. So thank you very much for joining us, and we'll see you soon.
Thanks.
Bye.
Thanks.